So PDSA will be the engine that drives our improvement effort. And I used to, one of my things in thinking about success was the more that you're doing PDSAs, the more PDSAs the better. But I've revised my theory. And my theory is about the more that you are learning from your PDSAs and that you're actually doing the S robustly is the important part. It's about the learning our way to improvement. So I think that's really good, but the quicker that you do them, the quicker you learn, and it's about scale and learning how to be robust about them. So we use PDSAs for testing or adapting or even developing a change. So some of the things that you're thinking about, you haven't fully developed, you can use PDSA to develop some of your change ideas. And you can think about, what was the one you gave me, Johnny?
Well, there's a couple of them.
No, the one we talked about before, sorry.
Peer support.
Yeah. So they were looking at peer support and how they might offer peer support better and how they're doing that. And I think one of the first things is go and talk to some of the other teams in the room. But that's quite to implement and have peer support, there's quite a lot of steps before that. And so the change idea might be developing to start with that you're testing as your peer support. When would it be valuable? What skills do you need? Who's the right group of people to work with peer support? So there'll be a number of things that you test and learn your way effectively. You might go and actually find out from other people about what did they find, what were the hiccups, the do's and don'ts that they found in implementing peer support. So you can use PDSA to develop your change as well as testing if that change is effective in your context. You use PDSA when you're implementing a change. So we know that the literature tells us that sensory modulation can be very helpful. So how do we know that we reliably and effectively use that? So that's about implementing the change and getting it to be used on a regular basis with people who it is appropriate for. So are we doing that effectively? Do we know that we're doing it effectively? When we do it well, or we do different things for different people, how does that work? And then when you get into spreading changes, if you've got a particular unit and they've worked and they've done some new changes and you've got other areas, there is no such thing as plug and play. You have to then test those change concepts. You don't just say, we're going from this unit to that unit, here, go and do this. You will still have to do some testing to learn out will it work here? Are there some things that we may have to adapt or change? Or consider slightly differently about how we might apply that change idea in another unit. We've done that slide. So there are 4 key steps to PDSA. And we do have a tendency in health to plan and do. Plan and do, plan and do, plan and do. As I said, the key that I've come across is we have to study and learn around that before we decide, yep, this is a good idea, this is not a good idea. And then once we consider how well that test of change was, then we either do it some more and see if it fails in different ways, or is it reliable in more than one situation, and repeat those cycles. We act upon those cycles or change, modify, or test wider scale. So one of the big things about PDSA, why we do it, we've talked about some of those. First of all, it forces us to think small, learn when in safe situations with 1 or 2 clients or with 1 staff member. You don't want to put all your eggs in one basket that has holes in it and it won't allow you to go up the stairs without crashing. It's about level of risk and degree of belief. So those are the big things about PDSA. Level of risk and degree of belief. So if you have a low degree of belief that it's going to work and huge risk if it doesn't, you really want to test small scale or maybe test in a simulation type manner. It's an opportunity to learn. How do we learn around this? What will work? It also is, sometimes good about just building will and allowing things to fail, or allowing to find out in what situations things are not going to work. So we use PDSAs. We have an idea, a theory about what we're going to do, and we test it on a small scale, and we follow up tests. So you continue to test, and you scale up your testing until you reach a point where there is low risk and a significant degree of belief. okay? And that this test actually results in the improvement that you're after. Prediction. That's a key point. Why do you predict about what you think? And if you've seen those PDSA sheets, we always talk about what's the change we're after and what do we believe this change will result in. Okay? Because we're all very good at the retroscope. We knew that was going to happen. Well, if we'd known that, we wouldn't have done it. So it reveals the difference and the gaps of our knowledge, and so that we learn more. Without it, learning is accidental at best. With it, we were able to predict and develop our knowledge around that whole cycle, an iterative cycle of building knowledge. This is a very useful slide, and this is what I've talked about. It's about guiding and scaling your test. So when you've got high confidence and the cost of failure is large, then it's very small scale testing. And there is a way, you can think about things if you're a bit concerned and there's safety aspects, but how you might simulate some of those ideas that you have. Talk through them, do a scenario, how that might be different. So it just gives you an idea of when you're ready to go to larger scale testing and when to go to implementation. And when we get into learning session 3, we talk a little bit more about implementation and sustaining. Key concepts for PDSA cycles. Think small, baby steps. One cycle at a time. Failures are a good thing for learning and can be better than successes. You actually learn quicker than when you have those small scale failures than when you success, because that kind of, you can, what's the thing where you can just continue to believe the same thing over and over again. As you move to implementation, test under as many conditions as you think are possible. So if you've got if you've got your peer support, does it work on the weekends? Will it work, are we going to have it on night shift? So you want to look on different shifts, different things. Will it work with junior staff members? Will you work with senior staff members? And those types of different conditions that you will normally expect to see in your system, you want to see if it works. So the top slide is around what we always see in the textbooks and the papers around how PDSA cycles, they go one after the other. Well, actually, in reality, it's not like that. It's the chaos in life that we see. Sometimes you take a step forward and 2 steps back. Actually, we've got to go back and test. That's not what, we need to go back and have another look at that, or rethink that, or actually that wasn't the right test, we've got to do another test. So that is definitely more what reality looks like, particularly in the settings that we work in. So don't feel bad if they don't just go one after the other. So when you're having successful cycles, so you're going to do multiple PDSAs, you want to start thinking 2 or 3 PDSAs in advance. So your peer support one, you've got 2 or 3, and you might also think about those PDSA cycles. What will it take to effectively either develop a change or test a change? And the thing is, this is about rapid cycle improvement. So you want to think 2 or 3 tests in advance about what you're going to do if it doesn't work, and how you're going to get 2 or 3 cycles going. Test with the willing to start with. Work with the willing. It's easier to start to get there. If it's some things that you can do, test them. It's a good idea to do that. Get people who are willing to have a go, and then you can start to get other people and test under different conditions. You don't have to always get buy-in. Find some willing workers or consensus and start testing in small scale, particularly when you're working at small scale. Be innovative. Find a way to make it happen. Collect just enough data to say, yeah, this is useful, or this is not useful, or this would be useful under with a different change. In later cycles, you want to scale it up and really make sure before you get to implementation that you've got high confidence it's going to work. And that's what you look at. And if you've got multiple teams, or you've got quite a few members of your teams, and you've got a number of drivers, you could look at different PDSAs on different drivers. And particularly if you've got, if you're working with your crisis team and you're working with your inpatient team, they could be testing different things and their process measures. And so then you've got an opportunity to be focusing on all those, on a number of areas, and so that you're actually rapid cycle, you've got the opportunity to learn more quickly across a wider range of your drivers. It just needs coordination and thinking about. That's a template. Have you all had an opportunity to see that template? I think there's a couple. This is quite a simple one, and I think the one we've put in your, but we'll put these out and they're available, and if you haven't got the access to them, please let us know and we'll make sure that you've got access to them. I think, to me, I try to get down to one page, simplify it, easy to use. It's also useful to keep these for a while, because after a while you're testing things and you go, why did we do what we did? Why did we change? And it's some good to have that, capturing that knowledge of what you've learned. And there are some other tools, and I've got one that's a PDSA tracker, and it's just basically a graph where it shows the ones that you're testing, and it has sort of symbols on it for abandon, that didn't work, adopt, or modify. And it's quite a nice tool just to visually show the activity that's going on and why you've got rid of stuff and what you've learned. But if you're interested in that, we can make that available. Some of the pitfalls. If you're not testing a change idea that links to the key processes or your theory, that's not going to be useful. You want to be testing the things that are going to add value. Failing to make a prediction before you do the test. Not doing the whole of the cycle, plan, do, too much planning, not enough doing. We need to get on. This is learning through action. Too much doing and not enough studying, plan, do. That's a classic healthcare failure. Not learning from failures. And if something didn't go as you planned, or you found something in your system you didn't know before, that's really useful learning. And that's, often where we get great traction, we've assumed something's happening and it isn't. Lack of detail and execution of the plan. So who's going to do what when? Being quite clear about that and making it small scale so it can be done. And the failure to think ahead. You need to be able to think a little bit ahead and plan a couple of cycles at a time.